it's an interesting conundrum where what you do for one part of your health sometimes conflicts a little with what you're aiming to do for, say, your heart health.
Yeah, absolutely. And I guess that's a good segue to that there are some harms from over supplementing with calcium, aren't there, Dr. Ann? So we sort of talk about the kidney stones and, lots of tummy problems with bloating and constipation. And I guess one of the things that we'll often hear if you go do a Google search is some cardiologists are very cautious around their calcium supplementation as well, aren't they, Dr. Ann?
We are. I mean, I think the truth is that the studies have been a little inconsistent on whether calcium supplementation does adversely impact the heart, but recommendations are that if you can't meet your calcium through diet or very sure that you're not meeting it, then it's okay to take a supplement, but you should take no more than 600 milligrams a day. And that's a
Yeah.
problem because quite a lot of the sort of leading calcium and vitamin D proprietary brands will recommend that you take two of their
Hmm.
calcium vitamin D tablets a day, and that will actually be 1,200 milligrams of calcium. So for my own patients, I recommend that they take one. If they're vitamin D deficient, I'll get them to take a standalone vitamin D plus one of the calcium and vitamin Ds. But it's probably not, our current opinion is based on sort of evidence and sort of compromise between the different specialists is that 600 milligrams is probably okay. More than that, we don't know is okay and we don't want you to do it.
And surprise, surprise, we fall on the same side of the fence. I also encourage people to ditch the combination vitamin Ds and calciums
Mm,
and get separate vitamin Ds because we love a bit of vitamin D, but we have to be cautious with our calcium. Yeah.
yeah.
Mm.
So we are probably just about ready to move on to vitamin D because it's hard
Hmm.
to talk about vitamin D and calcium separately because they are so related. So what does vitamin D do in the body? Why is it important to bone health, Moz?
So, if you pay attention to social media, it does everything and anything. But I think the things that we want to talk about today are the fact that we know that it increases the absorption of calcium from the stomach and the gut. So
Yep.
essentially, even if you're getting the right amount of calcium, but you don't have enough vitamin D, then the problem is that calcium just goes straight through you. And if you haven't got enough vitamin D, you're not going to make full use of that calcium that you're
Yeah.
getting from your diet. And as you mentioned, there's a lot of calories in a wheel of camembert or brie. It'd be a shame to be just getting the calories and not getting the calcium.
Yeah, but it's actually quite astounding that apparently, if you're vitamin D replete, you'll absorb up to 3 times more calcium from your gut than if you're vitamin D deficient, which is astounding. Yeah, because as you say, if
Very
you're getting
impressive.
lots of
Very
calcium but not
impressive.
enough vitamin D, you're almost wasting your time. Yeah.
Yeah.
So the
Which is why
recommended
they
daily.
come as cocktails. Yep.
Yep. So the recommended daily intake of vitamin D, interestingly, is only 400 international units from the age of 50, rising to 600 international units from the age of 70. But fascinatingly, more than 50% of people living in the southern states, such as we are vitamin D deficient. Now, the other really little cute bit about that is that Medicare, of course, some years back removed the rebate for the vast majority of people for vitamin D testing. So you can have your vitamin D level tested if you wish, but most people are going to have to pay for it. So,
Mm.
our recommendation is that you have a careful look at your diet and lifestyle. And if you think you're likely to be vitamin D deficient, you're probably right and just take a supplement. So, there was two ways of getting vitamin D. I guess we better talk about that more. Yeah.
Indeed, and just on that topic of the testing, I think obviously a very firm reminder that this is educational content, isn't designed to be individual advice, all that sort of jazz. But there aren't very many Australians that wouldn't benefit from vitamin D
Mm.
supplementation. So if you're thinking about it and you're thinking to yourself, "There's a $60 vitamin D test, or I can buy a year's supply of vitamin D for $20," I know what I'd be doing.
Mm.
Yeah. Sorry, your question was before I
Vitamin
got
D, we
sidetracked.
have two ways of getting it. What
Oh
are
yes,
they?
vitamin D. Two ways of getting it. So we can get it from the sun, of course, which we as also skin cancer doctors we have strong, firm opinions on how to get that from the sun, and we'll cover that, I'm sure. And the other way you can get it is through diet. So you can absolutely get vitamin D from some of the foods that you consume.
Yeah, so some oily fish would be the main source, yeah.
Yeah.
So your salmons and sardines. UV on the skin, so it's UVB on your skin, you will actually synthesize vitamin D, but of course, UV also increases the risk of skin cancer, and as skin cancer doctors, we are somewhat wary of a recommendation to increase your exposure to the sun. What if someone was hoping to get sufficient vitamin D from sun exposure? What would the safest recommendation be, Mo?
To make sure that they're paying very close attention to what the UV index is. So, you want to make sure that you are getting that sun exposure outside times of high UV index. So high UV index being 3 and above. So you want to make sure that anytime you're outside that the UV index is less than 3. So that's usually going to be first thing in the morning or last thing of an evening before sunset.
Yeah.
And you can get your
And you
sunlight
only
then.
need a relatively short exposure to make your vitamin D. It's not the case that if you stay outside for 8 hours that your skin will be busy making vitamin D for that 8 hours. It does it, the first 15 minutes or so, and then it stops for the day. It's need enough.
Yeah. So 10 or 15 minutes is really all you need. And it's outside high UV index times. Please don't get to know us professionally by virtue of producing a bunch of skin cancers. Yeah.
That's calcium and vitamin D, which are very closely associated, and many people will benefit from taking a supplement that contains both of them, but not too much calcium. But probably that should be an individual conversation with your doctor.